Correct in saying that, Sheila? Perfect. And so 4 on the call makes a quorum so we can hold our meeting. Welcome to the Health Equity Committee meeting. The date is 5/13/2024. The time is 2:34. And I'm going to kick it off. First off, I apologize that I am doing this remotely today. I appreciate your patience as I navigate on this very tiny laptop, do the best I can. I'm going to start by calling us to order and running through attendance. So I will call the individuals I see, and then Sheila, I will leave it up to you to roll call everyone else. So Laura Dietrich.
Here.
Kate Mildy.
Here.
Dr. Mbiwe.
Here.
Joe Zuzel, present. Is that Melissa Myers I see?
Yes, here.
Great. And Miss Sheila Hayes?
I am here.
Perfect. Is that Kathy Special? No?
Yes, it is here.
Oh, hi, Kathy. Nice to see you. And I'm sorry, sir, I'm not sure if I know your name.
Yes, I'm the new Human Resources Director in HR, Robert Scalise. Go by Rob.
Wonderful. Thank you so much for joining us. I'm Joe Zuzel. Thank you for coming today. Perfect. So we are through attendance. We'll open it up for citizen comments. Seeing no one in the waiting room or any citizens in the room, we will move forward with the approval of minutes. So I'd like to make a motion to approve the minutes of last Health Equity Committee agenda as submitted.
So moved.
Kate Mildy moves. Can I get a second, please?
I'll second.
Great. We'll do a roll call vote. So Melissa Myers.
Yay.
Kathy Special.
Aye.
Robert Scalise.
Aye.
Sheila Hayes.
Aye.
Dr. Mbiwe.
Aye.
Kate Mildy.
Aye.
Laura Dietrich.
Aye.
Joe Zuzel, aye. Motion passes. Minutes are approved. We'll move forward now with chair updates. So I don't know if all of you saw the 2 articles that Sheila had sent out that were submitted by John Salamone, our city manager. He wanted our committee to take a look at it. Basically, it talks about how we see the use of recreational marijuana, particularly among our teenagers in the city of Norwich, on the rise. I don't think this is a surprise to a lot of us who sit around the table. We knew that this was definitely something sort of moving forward on that. It's interesting because, you know, our goal is to eliminate health disparities and health outcomes of all people in the city of Norwich due to all forms of current historical systemic oppression, injustice, and discrimination. And as we know, there are a lot of disparities when it comes to our minorities and, you know, that access of cannabis and actually how people were criminalized in that in the past. The articles really make no mention for that. It was just kind of an awareness to that. So I thought it was interesting that I mean, I know Hannah very well, and I like all the work that she does. I think it's very impactful, but I thought it was very interesting that it was just sort of a general statement to how everything was happening there. So I figured I would use my time here for updates to see if anyone had any other comments or wanted to discuss the article further.
If we had had the police chief here, it would have been interesting to ask if he's seen any tie to any other teen related crime, you know, with like sales and, you know, things like that, to see if it's impacting other areas of the city.
I agree. I thought it was very interesting too. You know, some of the CHWs, community health workers that we work with, you know, in their spare time, they're at the basketball courts, they're playing basketball, they're doing all kinds of things. And they've noticed that there's a major increase just in terms of like what they're witnessing and who they're playing with. You know, they see a lot of that happening. And this is something that we talked about too, when we talked about some of the cannabis money that was coming in to the city and how we could utilize that for good, especially in terms of stemming some of this or some culturally relevant education surrounding this. So I think it's a timely topic. It's just, I wish there would have been more of a light shown on some of those disparities, because we talk about packaging, we talk about where we're placing these things all the time, and we know that those are relevant issues. Anyone else want to comment or talk about those articles? Okay, well, I'm moving right along today. It's a nice day outside, and I know we're all coming off a wonderful Mother's Day weekend, so we're just going to kind of cruise through. There is no guest speaker for today. I will open it up to see if anyone has suggestions for future guest speakers that we could reach out to. We so far have not been successful securing a guest speaker. Sometimes we don't need it though, right? We've got enough work on our plates. All right, hearing none, we'll move forward with our subcommittee report out. So this is the first time that we've actually reported out from the subcommittees. So I figured what I would do is I will just, call on a committee. We'd love to hear about, like, did you meet? Did you not meet? If you didn't, fine, no big deal. And then, if you did meet, let's talk about some of the things that you were working on. I know some committees did send me some notes. I appreciate that. I'm putting that all together. But this is kind of our first crack at this, right? So so Rob, just so you know, we're in the midst of developing a health equity plan for the city of Norwich. So basically what we're trying to do is take all of our expertise around these 1, 2, 3, 4, 5 very large, very, very general buckets and sort of put it all together in a plan that we can kind of show the city sort of some best case, best practice, or some things that we're doing to sort of increase that communication, that understanding, and also make some recommendations. It's really up to the city what they want to do with the plan, how they move forward with it. It's just a way for us to tackle those very large resolutions that were put forward and tasked this committee. So that's kind of how we put our heads together. So you're joining at a perfect time. And once you take a look at the committees today, just let me know if you're interested in serving on a committee, and if so, which one. And today we're just going to kind of report through and kind of see what we found, and we'll talk a little bit about the process, and we'll also talk a little bit about the information that we gathered. Sound good to everyone?
Yes. Yeah.
Great. All right, so moving forward, I'm just going to tick down this list as I see it. So workforce equity, hold on, my screen is so small. Workforce equity and workplace inclusion, Kathy Special, Dr. Qureshi, and Laura Dietrich. And I know you guys did send me some notes, but if you have a spokesperson from the group who wants to kind of walk us through it, I think that'll be much better than me just kind of sharing my page here. So anybody interested?
Kathy is
I can
passing out some copies. Thank you.
I should have sent these to the entire group. I sent them to you, Joe, but I didn't send them to the entire group. So Laura, Dr. Qureshi, and I met. I'll speak since nobody else spoke up. We met prior to what the last meeting was supposed to be, and I think our marching orders were to come up with definitions and questions and that kind of stuff, kind of narrow down our field a little bit. So this, oh good, you have it up on the screen. So this is what we came up with in our discussion. Hopefully it's kind of in line with what everybody else was thinking and working on their committees. Just read through it on your own. If anybody has questions, we could probably field some questions.
Yeah, so I had a couple of questions from the top. So, when Kate and I met, we were talking about this too, and we we're kind of just thinking about, okay, just like you said, what are these definitions? What are we trying to look for this? So, in reading this, are you saying that you'd like to hear from all organizations about, for example, childcare, transportation, immigrant employment resources, so that we all report on that? Or are these just sort of things that we're looking to address as we move forward?
I think probably both. I think when we're trying to narrow down the scope, maybe generally what we would like to see, because we're making these recommendations really for the public as well as this committee. So even for the public, we'd like to see everyone kind of taking assessment of our city and where the different pockets are that we need to get to and get out into those different pockets. Language, especially whenever we're posting any kind of job postings, make sure we're using at least the most dominant languages in the area.
Mm-hmm.
I know that can be tricky too, because we don't all have access to translators, but it's a good goal to have.
Yeah,
so that's kind of the way I think we were looking at, Laura, Dr. Qureshi, if you want to weigh in on that, that's, I think, how we were looking at it. Yes, this is for our committee, but it's for the general public as well.
Perfect.
Yep, exactly. That's what we discussed. I agree. Thank you, Kathy.
Great. So I was particularly interested, and please, anyone jump in, comment on any of this kind of stuff, because we're really trying to set sort of the framework for how we're all going to capture this information. So I was really interested in number 4, hiring panels, individuals need diversity, equity, inclusion training on an ongoing basis to stay current with Norwich demographics and the changing situation of our, small screen, of our community members. And so I think this is a nice opportunity too for all of us to sort of report on like how we do that, right? So how are we offering professional development on a regular basis? What kind of professional development are we offering? I know, like for Hartford Healthcare, for example, we have colleague resource groups and diversity, equity, inclusion, belonging councils, and these are made up of staff members who sort of run and hold that together. So there's a lot of opportunity to sort of, I want to say, like, elaborate on number 4. I was just wondering if that is something that individuals also think might be a nice thing to sort of share in the plan.
Yeah, I think you hit on number 4 also, because when we were working on this, we were looking through the lens of how to collect data to then aggregate that becomes best practices that are recommendations. So I think that we changed, I like 3 too, because we changed what we were trying to capture into questions for you guys, basically. So are there ways to track how far applicants make it through the hiring process in the city, right? So that's another thing, is through the lens of how does the city do things. I think there's number 1 is really important to consideration, because I've been at those meetings too, and I think we can't have an equitable conversation about equity without addressing those things. But how are the health equity committee members, organizations addressing these things is what's going to lend to our recommendations to the council. So I love number 1 for a number of reasons, and I think number 4 and number 3 are best for in terms of the guide we're developing for council.
I love that. So basically what we're looking at here are the questions that all of us would answer from our own agency's perspectives and standpoints in order to address some of these things as best we could. Is that kind of what we're talking about?
Could I add a thought?
Sure.
If in an altruistic world, the city would adopt whatever plan, we recommend, and then share it with the public as far as in the Norwich area, and advise the employers, leaders, organizational heads, business owners in the city of Norwich who employ other people that work and live in Norwich to say, we believe this is the best practice for how to approach improving the crisis that we feel is currently going on, and as far as racism impacting public health. And so we encourage you all to follow this guide, use this as a guide, and look at your own business, your own organization, your own, they'd be responsible for all the city offices and whatnot, but the infrastructure, city infrastructure, but really want to make a step forward, act like a leader, and say, we encourage the rest of you, members of Chamber of Commerce, private organizations, nonprofits, to use a similar guide in terms of how you assess your organization and how you're contributing to stopping this crisis. So if all of our questions in any of our subgroups can be used by the city, they should also be able to be used by anybody else.
Yeah.
And so hopefully they like the plan enough that they could encourage others to use the same, and then look like a leader, and then hopefully walk the walk, walk the talk, not just say you're a leader, but actually be it by doing it and showing the city what they're doing. It's all putting it into practice but I would just suggest that might be something we encourage.
And I think, you know, we'll have ample time in the beginning and at the end of the plan to really kind of talk about some of that philosophy, some of that actually putting things
Yeah.
into practice, how we recommend that. I really
Yep.
like what you brought up when you said, like the agencies looking into best practices and really having to examine those things, because as some of you know, I sit on the child care task force for the healthcare pipeline, which is a very difficult group to sit on. And honestly, like, I think a lot of us have difficulty addressing like what we're doing about childcare these days, right? There's not that infrastructure, there's not those resources. It's really not our scope either. Like, it's a very difficult thing if you're a healthcare organization to all of a sudden get into the childcare business. So, you know, we may have opportunities in this when we're all filling it out from our agency standpoint to say like not addressed. And I think that also brings a big sort of message to the city too, and talking about like resources that are needed that we're not covering. So I just want to put it out there that if we're answering any of these questions at any time from the agency and you in your agency don't have answers for that, that's okay. It's not going to be like a mark against like what we're doing. It's just honesty, right? So, you know, we don't have childcare resources at Bacchus Hospital, right? Like we did in the past, we don't, but that's just something that I think is important for the city to be aware of when we know that childcare is a crisis and we're moving forward with that. Does that make sense what I'm saying to everyone?
Yes.
Yep. It is.
Yeah.
I'd like to provide some input on the number 4 real quick on the applicant tracking.
Sure.
Just an FYI, HR is going to be transitioning from our current applicant tracker by force because they're getting out of that part of their business application tracking around October 1 to another one. And I've done a quick review of the current vendor and then the new vendor. And there's a marked difference between their ability to track some of the data that 4 goes to. So stay tuned on that. I'll have more information in the next few months about the city's ability to get a better handle on our DEI efforts through the application tracking
I love
process.
that. That's great. Do you have any other suggestions in terms of things that would be helpful to report out from other agencies around this workforce development? I mean, so right now we've got, you know, 4 sort of large, I'll call them buckets again of, you know, issues, concerns within workforce development, but are there things that we're missing that we would want, you know, all the members of the Health Equity Committee to report out on from your HR standpoint? Do you think there's other things that might be helpful that we haven't included?
I have to take a better look at it. I like number 2, the thought there about postings to spread the DEI message. I think that is very important, and that is a recognition of the community we have here in Norwich, which is very diverse. So just a comment that I like too. It's cutting edge. As far as 3 goes, public education, what jobs are available, where are they, and what resources do I use to find them? That's the constant struggle HR has in this very tight marketplace to find qualified people, you know, those who meet the MQs, the minimum qualifications for a particular job. We're doing our very best to do community outreach. We've got some ideas in HR about how to do that a little bit better, maybe a job fair here or there. So again, maybe at the next meeting, I'd have some additional thoughts.
Great.
And
So-
I jump in, Joe, before you, unless you want to respond to that.
What's that?
I said, unless you want to respond to that, can I jump in before you?
Oh,
go?
please. No. Go ahead. Yeah, I was just gonna ask if anyone else had anything that they'd like added onto workforce. So go for it.
So I'm a bit confused. First, I mean, I like the way it is laid out. I am a bit confused on number 3, which talks about public education. And not quite sure. Then when I look at A, B, and C, I'm asking myself, why are we? I don't really know then what you mean by public education versus I was looking at are there, you know, like we have the manufacturing pipeline program. That is a career development program that you get a certification in. You get CNA. So I'm not quite sure what public education.
So I had the same confusion. I thought it meant like schooling and education system, but I think this means more of
Educating the public.
like information
Recruitment.
That's
with the
how I,
public.
community
Yeah,
outreach, getting the
yeah.
message.
Public.
Yeah.
So
That's how I-
that's what I
Can
want.
we change it around then? It's
Yeah.
public
Yeah, I think you should probably say recruitment strategies maybe or something like that, like recruiting and retention, because retention is another key aspect. I would say that that's something I'd like to see added in somewhere, like how are we retaining individuals with DEI awareness? That was something that came through in our CHIP goals, our China process. So I think like that would be very interesting too. How are we retaining folks?
Can I add to that concept? So for 4, I'm gonna say I know at Generations, I asked our HR department to dig further than just hiring. So I full on disclosure say I can't provide this info if you all make me answer this question.
Right.
So, but what I would add to it is, have you tracked the diversity, the demographics of people who did not get the jobs, who got disciplined, who did not get promotions, etc., who didn't get transfers and whatnot. So not just applicants, but applicants who are successful or unsuccessful, but then also existing employees who became disciplined, etc. Because my question to my HR department was, is there any trend in how our demographics are represented in those actions? Would we unfortunately see some sort of trend in terms of who gets the jobs or who gets the promotions or who, as far as discipline, etc.? Because that all lends to health equity in terms of having benefits or not. If most of our people we term trend in a certain direction, well, now you're denying perhaps equitable access to healthcare benefits as far as health equity, etc. So,
Melissa, do you
question
have
of not just looking at hiring applicants, but other pieces of HR to see if there are trends. But I can tell you, I could never provide that info right now because we haven't collected it all yet, so I could never answer that.
Yeah, I'm sitting in the same space. So one of the things I'm pushing is to see if we have positional filters, because we'll have filters for race, ethnicity, and language and location of where individuals are working, but we're not breaking out what those positions are. So I would be very interested to see, okay, well, this floor in the hospital, how many individuals work in environmental services? How many individuals are clinical? How many are providers? Because that tells a different story in terms of your percentages and your numbers. And just like yourself, I'm not quite there yet. We're working on those kinds of things, but I wonder if that's a similar best practice that we could recommend and say like, hey, we're not even quite there yet, but we would think that this would be a beneficial thing. This is something we're working on.
If you're talking about equity, yeah.
Right.
Yeah.
So Joe, on that, can I put my NAACP hat on?
Sure.
Because I'm gonna be addressing some of this. I'm not quite sure how the survey this time. But the state NAACP has, since 2007, 2008, they've developed a survey asking these exact questions of all the hospitals in the state of Connecticut. And we don't get a response, or the responses are very limited. That's one of the jobs I've been tasked with, to sit down. Again, I think this is my 4th survey.
You may want to start with how is the data collected? Because I know, like, I could never answer the question because of how it's not collected.
But we've been asking,
No, I hear you.
I know, we've
I
been
hear you.
asking
Yeah.
the questions. At some point in time, somebody should say, this is relevant.
Gee, maybe we should collect this.
So maybe we should collect it. It's
Yeah.
relevant.
Yeah.
Correct.
Okay.
Yeah.
And I think if I can frame that, I think, our job is really as the individuals who have that historical perspective of what was trying to be done, what still hasn't been done, or what we are doing, and making those recommendations to say, hey, we believe this is in the city's best interests. It's in all of our best interests, whether we're doing them successfully or not, right? So there are some things that we're doing that are very successful that we're gonna really stand up and say, we can show you the data on this. This is good. We're doing great. But there are other things like some of the HR data collection and reporting that we've been trying to work on for years and years that we haven't quite gotten there yet, but we can still make that as a recommendation. Does that make sense?
Yeah.
Yeah, it does. I mean,
Yeah, if we're
in this
okay
day
with
and
it.
age, yes.
Yeah.
Because the state won't take a stick and beat you over the head. They keep wanting to hang
Yeah.
on it. That's why it's not being done. We know why
Right.
it's not being done.
Mhm.
Right. Well, and I think it may be up to us. This is an opportunity for us to really look in the mirror and go back to our agencies to sort of push that forward, right? We're all on this committee for a reason. So I think, that awearness and pushing that is also a helpful thing. Dr. Qureshi, we're just about to finish up with the workforce development. A lot of great feedback on this. I think you guys had a really good job right out of the gate, coming up with some questions that everybody's kind of looking to answer. We sort of clarified a couple of things, but you'll see all those kinds of things in the notes. Anything you wanted to add in terms of things that you think might be missing or logistics with any of this kind of stuff?
No, I think we had a good discussion, and it's captured in these notes that we just shared with you.
Great. So does anyone else want to comment on workforce development before we move on to our next committee? Okay, great. Just bear with me here while I shift some screens around. So I think we're going to do data collection and dissemination. Dr. McLean, did you guys have a chance to meet?
We have not met in person yet. We've been batting around some dates and we're still working on that. But I've done some side things, in particular with the issues of xylazine and things like that. We've started to have some good conversations which are similar about how do we approach data for a certain issue or a certain subset, like the bigger categories of food, housing, transportation, utilities, and personal safety are like the kind of the vernacular that most hospitals and most cities are focusing on for health disparities. Like we started to collect some questions of what we want to talk about, and then in particular, we have a couple of examples in the Norwich area as great first steps. So we've got a lot of ideas. I don't know if Dr. Wally, I don't think he's on today.
He couldn't make
I
it.
know
He
that
sent me
Patrick's
a
coming
message.
back
He wasn't
from
able to make it.
college thing. So we're in communication. We've got some ideas. We're going to meet hopefully within the next week.
Perfect. Thank you for that. And that's just sort of the idea too. So we're really trying in your committees, you're really trying to develop, like Dr. McLean was saying, and as Kathy and Laura and Dr. Qureshi sort of illustrated, high level concepts, these questions, these things that we want to pose to everyone on the committee so that we can get everyone's answers and put it all together, right? If we have certain needs and things that we think are important, include those as well, and we can sort of sift that out. But it's really sort of creating a template for us to be able to give it to whomever in our agency can answer those questions, right? And so I think that's a good start for that. Any questions or suggestions for data collection and dissemination?
I'd certainly welcome additional ideas if people have a topic of interest. Otherwise, we're starting to run
I
out.
will say, Patrick, Melissa, myself, as well as, Jen or Dr. Walia, we all have our community health needs assessments. We all have, improvement plans. And there's a lot of data that we're working on right now with our current China cycles. So for the first time ever, L&M, Hartford Healthcare, and all the collaboratives of which, all the federally qualified health centers and the health districts are all engaging in a community survey where we're going to be able to disseminate that survey on our own. Because in the past, Data Haven has not been able to capture individuals in our region the way that we felt was sufficient. So we've been lobbying with Connecticut Hospital Association for the last 4 or 5 months, and we've actually getting a digital survey created, and we're having those collaboratives be the individuals who are going to be able to get that survey out and get that information. So this has been a project of mine for the last 3 years. Those of you who know, so this is going to be a really exciting time, and we can give you information on how this process is going to roll out and the logistics from that. But even the tribes are involved in working on this. So this is going to be a really interesting way to sort of set some equity standards, because it's most often are minorities who are left out of the community health needs assessment, and we get not applicable return to us because of the sample size. So as a region, we're doing something to eliminate that. Anyone else want to comment on data collection dissemination?
Other than I would say that you can apply that on the city side as well. I mean, they are trying to do it through at least NCDC through Envision 360. But we do know, I mean, 40,000 people, 20,000, you say adults, and I think there's less than 500 people that log in and comment on, information that they're trying to get feedback on. So
Right. Yeah, taking a look at some of those
public hearings public hearings are dismal. I mean, there's one tonight. I'll let you know how many people show up.
Well, it's a lot about challenging the historical sort of process, right? So in the past and even nationwide, they're going to tell you that the best practices are landline surveys in English and Spanish, and that's it. I've actually heard that only 12% of Connecticut individuals speak a language other than Spanish or English, so it's not worth it to do it. Like more mail-ins, right? And so we live in a digital area, right? We have individuals who are working 3 jobs. They don't have the time to do these things. We have undocumented population. So we really have to create different ways to move forward with this data collection. It's about changing the whole process. It's just like how we recruit for diverse individuals. We have to change the frameworks that have been around. So that's the opportunity here. I agree. All right, we're going to move to direct services and community engagement. Kate, I'm going to kick it to you because I'm doing way too much talking as it is anyway. You can kind of explain what we decided to do and where we are in the process and ask individuals if they have any questions.
Yeah, are you able to pull up our survey, or do you want to let me share and I can?
Yeah, I'm going to let you share somehow. Let's see here. I'm just going to make you the host, but you're going to have to kick it back to me. How's that?
Deal.
Oh, the pressure's off.
Okay, let me pull it up. All right, can you see that, guys?
Again.
Yeah.
Okay, so Joe and I met and we just went through the guide that was for the city. Was it Philly?
Yeah, I think it was the Philadelphia Health Equity.
Yeah,
Plan.
so
Yes,
that one was just like a really well done piece and kind of what we had envisioned this group would roll out with. And so what we did is we went into the direct services piece of their guide, if you will, and pulled the areas they were addressing and turned them into questions. So this is a way that we could ask you all, committee members, how you do things, and use the questions as headers effectively for when we build the guide based on your answers to these questions. So how does your organization evaluate resources and its capacity to survey community needs? What steps does your organization take to analyze patient health outcomes data, community survey data, or survey reports? How does your organization identify potential interventions in disparate populations? How does your organization conduct outreach in diverse communities? So that's something that Sheila hit on, right? That I think maybe a common vein in all of our subcommittee section areas of focus. So how does your organization evaluate customer service? What operational changes have you made to identify or to improve your ability to implement interventions and such? How does your organization evaluate your responses to initiatives? What employee activities has your organization identified to improve their ability to serve? So, I mean, now as I'm reading it out loud, it feels like it goes on forever. But once we get some of this, Joe's the only one that's had to answer it.
It took me a couple of weeks to fill it out. I'm going to be completely transparent. And I had to email it to a lot of individuals. So I'm just going to say.
Yeah, so it's like, yeah, in practice, maybe kind of a beast, but we can pare it down. Again, this was our first try. But the idea behind it was to identify what exactly we want to speak to and ask you guys about that. And use what we want to speak to, again, as our headers for this guide. And the Philly outline was helpful to us in doing so. So they really broke it down in other subsections, but we talk about what does your organization do to increase the percentage of people of color working quality jobs, right? So there's some really interesting and thought-provoking, hopefully, questions in there. And that's how we came up with it, and this has kind of been our approach. It's nice because then the responses are all together. It's easy to, of course, export it to Excel if we wanted to do it that way, or it makes these nice little groupings here, as you can see, as more responses fill in. You guys are probably familiar, but it makes it easy for us to aggregate that data and develop and highlight commonalities in each of the answers to develop best practices is basically it.
And I think you'll notice that some of these questions can actually apply to your own committees as well. So you know what I mean? Like we might be able to take a question out of that, and for data, for example, I can see that going to your committee, Dr. McLean. I can see the information about how we are, you know, outreaching for quality jobs going to workforce development. But the whole process here is just an idea to show you that this is something that we could create for, you know, every committee to have this sort of a survey that you could then share to your HR departments, your community health departments, your clinical departments, whatever you need. You could, I was even just like copy and pasting the questions and putting them in an email, and then from those answers plopping them in there. And then to Kate's point, when we get around to writing this and putting it together, we have everything in one space, and we can really say, okay, you know, this is the concept of what we do. This is an example of what it looks like from UNCUS, from Generations, from UCFS, from HAC, from the city, from Otis Library. You know, we could have all of that together, and it might be a really compact way of doing it. So I just wanted to put it out there as like a logistics example, and feel free to also look at the Philadelphia plan. And if there are, you know, subjects in there that you think are great questions, you know, come up with your own as well, but you can also utilize that. I think it's an easy way to move forward.
And
Questions?
it's a suggestion, because I don't know, we all have a different definition of what quality. There's a question in there about quality. I'd like to see it be more specific. And I was just talking to Melissa, like it's no secret, most organizations, including the city, when you look at top management, mid-management, the lack of diversity hits you right in the face. Okay, and so until we put that question directly in front and not skirt around it, you're not going to get an answer, and then we're not going to provide opportunities for individuals to then look at what can they do differently, or how can they do something differently. And there could be an organization. I mean, I know I'm not picking on, I'm only using all of them as a highlight in the fact that I do know that they were very conscious about hiring some of the MLK scholarship winners that hit the paper. They've done that in the past. Like, look, who's getting our scholarship money, and when they come back, what does it take to entice them back to the area to then come work for you, because you've made a $20,000 investment in them. Yeah. So I just use that as an example.
No, I think that's great. So in terms of direct services, quality kind of is more of like a medical or clinical term. So I get that. I mean, we could define quality if we want to. We could, you know, change it and tweak it. You know, we can have Kate send it out to individuals and you can take a look at it. Maybe you realize like, hey, this question is my question. It doesn't belong in direct services survey. We can move those things around. But really what I wanted to show you is just sort of the process and how we can make it pretty easy. So in your committees, if you come up with, you know, 5, 6, 7 questions that we need this information for, then we can disseminate it amongst ourselves and amongst our agencies to the people who know, to get that information. It really saves us that time in terms of data gathering. And Sheila, to your point, I think parity, especially when we're talking about high level executive jobs, leadership jobs, training for that could definitely be a question that comes out through the workforce development survey that says, what is your organization doing about parity at that certain level? Like, what things have you engaged in? Where are you moving forward on that? So maybe that's a note for workforce development too. Maybe we can add that question in if we all think that that's important. Other questions about the survey? Do we think that this is a good way to do this?
And I'm happy to, if folks want to send me questions to add to the survey, you know, I can either make the whole committee editors of the survey, which only scares the control freak in me a little bit, but or people can send me their questions and I can happily, you know, be the editor of said survey. And the way that we can build it in Google Forms is to have different sections too. So I could easily make the one Joe and I built for our section and build the others for the other committees if people like this direction.
That way we don't have 5 surveys. We have one survey with like 5 categories, and then there's a bunch of questions. It will be a longer survey, but like I said, it may take us a while to fill it out. Like mine, I mean, I left maybe 2 blank just because I wanted to make sure we had some information for this meeting, but I really had to track people down, send them the questions. I had to explain what the health equity committee was, why we were asking these questions. So, you know, I can imagine that it's gonna be a process, but at least if we have the tool to get the information and we're consistently working on getting that information, then once it's all in, we write the plan and we're in a good space. I just didn't know if anyone had like questions or logistical issues with that idea.
I think it works for our committee because we just have straight questions.
Yeah,
So-
I saw that. I liked that a
Ours
lot.
could definitely pop right into that because we use the City of Philadelphia guide as well.
Yeah, why reinvent
Yeah,
it?
we're right with you. You could pop us right in there.
Okay. What about Laura and Kathy? You guys think that would work for your committee too? If we took some of your questions, popped it in there, expanded on some questions?
Sure, I think so. I
Perfect.
think it makes way more sense to have everything in one place.
Okay,
I
great.
agree. Yep.
All right, so moving forward, that will be our plan then. I want to make sure we get to our other committee though. Hold on. I am the host again.
They're not here unless they sent something.
So impactful learning and professional development. I did not get anything from Police Chief Patrick Daly or Dr. Walia, but we can move to budget equity and legislative advocacy, and I have that somewhere too. Hold on, here we go. Share my screen.
I
Excellent.
did find a copy.
Yeah.
Yeah.
Oh, I'm sorry.
Okay.
Yeah.
Already looked at.
Okay, great.
Thank you.
All right, so I'm gonna pass it to Sheila and Missy
Yeah.
to run us through this.
You
Right,
want me to go?
Yep.
So,
'cause I'm trying to
we-
write.
oh, okay, gotcha.
Thank you, Sheila.
So we had budget equity and legislative advocacy, fun topics. So we used the city guide that you guys had distributed before, looked at their questions and then also tweaked and added some of our own. So you guys all had a chance to go through it. I don't have my glasses with me, so I'm gonna put my sunglasses on, the prescription. So, budget equity, really the gist is about how do you allow your resources to be distributed in an equitable way? How do they support equitable access to healthcare for the employees across the city, et cetera? How do you make healthcare resources accessible to all the employees, et cetera, in the format of how the budget is developed and implemented, on a yearly basis. So this would be a good guide every year they develop the budget, quite frankly, because once you do it, once you look at it, a budget is only a year at a time, usually unless it's 2. I mean, every city or state is different, but cities on an annual basis. So if they used it as a tool that as they were developing it, they were incorporating these priorities about getting community input, looking at the recent community health needs assessment data, et cetera,
into their planning ahead of time, then they would be ahead of the game in terms of committing resources to the issues that lead to health equity. So that's what that's about. And legislative advocacy, we considered the local, state, and federal kind of levels and how the needs get determined and prioritized about what needs to be advocated for, really on, again, a yearly basis, because we all know legislative priorities change in a very dynamic way, minimally on a yearly basis, you know, usually even more often. So this was about how do you gain, again, community input into what your priorities are? How do you establish across your districts? There might be different needs in different districts or across the city. And then how do you gather that and then actively engage in that across your district, not just how the leaders engage with the legislature, whether that's city, state, or federal, but also how does your community and how do they access their legislators in various ways? How does it get communicated what these priorities are and what's happening about them through different media formats, et cetera. So we think, again, these are we did the same, we put them in question format so that the city could look at it and determine in a planning way how to incorporate these items rather than after the fact, you know, but in the early stages of plans in each area. Go ahead and add.
Yes.
So, but I think we could pop those into the survey.
Yeah.
Just as easily, and an organization could just put themselves in place of wherever we say city. So
Yeah,
how do
that's
we
exactly what I was thinking too. Like where
Yeah,
it says,
how do we
has the
generate-
council considered priorities? It could say,
Right.
how has your agency considered priorities for funding, blah, 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 blah.
Right.
I think that's perfect.
when I develop my budget of generations, am I distributing those funds in a way that's equitable for all employees? Do I put staffing development funds in there that are equitably accessible by all employees, or do I put all the money into physician training, you know, or et cetera? So, yeah, I think any of these questions could be answered by any business leader, owner, city council member, organizational president, you know, et
Yeah.
cetera. So
Wonderful. Questions? Does anyone have questions for?
Sheila may want to add.
Oh, Sheila, do you have anything you want to add?
Just on the city side, and Kate and Rob could correct me just based on my observation and what I know. On the budgeting, budget equity could definitely go to departments within the city because they develop the budget like from probably September through December, somewhere in that time frame. So they have a direct impact that way on the budget, even before it gets to the city, to the council. Or approval.
Definitely. Yeah, we develop our own budgets, but then that top bullet, does the distribution of resources ensure equitable opportunity to all residents? That is out of our purview, right? So if there's a finite amount of money in the annual budget, if it were up to my department and me, I would take all that money and give it back to people in social services, right? So I think there's a certain limit to how much of the distribution of resources is within my purview.
And that's what I was gonna say. There's some though that would be directed more at the council, the city manager
Right.
and the council.
Yeah.
Because they control what the final budget and the final allocation. But in order to get there, you need the departments to have the input into the other questions. Okay.
Definitely.
Yeah.
Legislative, I don't, not that the departments don't have legislative advocacy or action, but I will tell you this city does a very poor job when the state legislative session is in order. And they do a very poor job when they're out. And probably that's more important when they're not in session to meet with state legislators and our state reps. Because they formulate, which, you know, next year will be the biennial budget as well as whatever new legislative priorities, we don't do a very good job. So I think that's where some of the organizations I know do an excellent job in that area. And there's some that do mediocre. City does a very poor job. So that should be an area that we should see a lot of, if it's answered properly and correctly. We should see a lot of areas of opportunities, but then some organizations will have, that's their strength. Because you hire people to do that. I mean, you have people like Harvard Healthcare. You have your own legislative and staff.
Right. Yeah, there's a lot of agencies that sit on this committee that have lobbyists. So I mean that there will be information to talk about for legislative advocacy, I'm sure.
Any other questions for us? Sorry.
Questions? All right, hearing none. So is your committee comfortable with these questions being like retooled as we talked about and developed into a survey? Because we can start that, you know,
Yeah.
as soon as possible. Does
Absolutely.
anyone see anything missing from budget equity or from advocacy, legislative advocacy? And I know many of you have just received it today, so we'll give you, you know, some time. I mean, we don't meet again till the next month. So if there are questions or if there are additions or what have you, please communicate those with me and I'll make sure that I disseminate it to the committees. Let's keep that in mind. Okay. So I'm gonna pop back to our agenda here, keep us on track.
Very good place, Jeff.
What's that?
Because you're in a very good place. Our clock says
Yeah, so I mean, now we're just at other business. So I just want to talk next steps really quickly to start other business. So moving forward with your committees, please continue to develop those questions. Please send them to myself and Kate, and we will make sure that that gets into survey format. We can also sort of tool some questions around. So just looking at our questions today, I know there are a couple data questions and HR questions that should probably go in different buckets, and we can move that around and set it up. Next steps will be for you to continue to meet, develop those questions so that we can get them into the survey. And once everybody's happy with the final survey, we will talk about dissemination and sort of working within our own organizations to get that information. Does that sound good for next steps? Okay, silence means yes. So anyone else have other business that they want to talk about? Anything else we need to say? All right, I'm just gonna say I'm really happy with the progress for the meeting today. Like I feel like we're moving towards something. I feel like we're creating products, we're communicating, things are getting together. So I think we should all be very, very proud of ourselves. I think this is good work moving forward.
So I just wanted to ask, are we still on the target is to be ready by the October? We have another reporting.
Yeah, I mean, really, I would love to be able to have a plan in hand for fall. I think that was kind of our goal, to be able to do that. I think the quicker that we get the questions together, the survey approved, and then it will really be about every individual just pestering the professionals in their organization to get this information. I think putting it together, we can come up with a small group that will sort of write it and put it together, and then the committee will approve it once we see it in its final draft, and we'll just kind of move forward. It's kind of like what we do with our Chinas and chip processes, honestly, if I'm being honest. It's just a lot more like subjective data than qualitative. Does that sound okay to everyone? Is that a good time frame? Do we think that that's doable? Okay.
Yep.
Seeing the head nods. Perfect. So that being said, I'll ask for a motion to adjourn.
Motion, so moved.
Second.
Okay, Sheila. I see Dr. Qureshi seconding. And we'll just do a roll call really quickly here. Melissa Myers,
Aye.
Kathy Special,
Aye.
Rob Scalise,
Aye.
Sheila Hayes,
All right,
Joe Zuzel, I, Dr. Qureshi,
Aye.
Dr. McLean,
Aye.
Laura Dietrich,
Aye.
Dr. Mbiwe,
Aye.
and Kate Mildy.
Aye.
Okay, so we are adjourned. Thank you again for your time.